in the larger cysts of the spleen, which can be done by open approach or the laparoscopic approach. I am presenting the case of a 46-year-old male who presented with right and left upper quadrant pain and fever for 7 days. On palpation, a 12 by 12 cm swelling was present in the right upper quadrant, extending 10 cm below the costal margin. Another similar swelling was present in the left upper quadrant, progressing towards the midline. Ultrasound revealed multiple large hepatic and splenic hydatid cysts with daughter cysts. Here is the CT picture of the similar findings, where we have the coronal and the axial cut section showing a 13.8 by 15 by 11 cm cyst in the subcapsular location in segment 7 and 8 of liver, which is the most common site of the hydatid cyst in liver. Another similar cyst measuring 13 by 10 by 12 cm was present in the splenic parenchyma, reaching up to the subcapsular surface. So based on our findings, we underwent pericystectomy and total splenectomy via open approach. Post-op period was uneventful and albendazole was given for 6 weeks after surgery. No recurrence was seen on follow-up, and we sent the specimen for histopathological examination, and the findings were consistent with the Echinococcus granulosus infection. So we know that splenic involvement in hydatid cyst is rare and the clinical presentation lacks specificity. And early diagnosis and management is important to prevent the complications. Treatment is determined according to the stage, the size, and the relation of the cyst to the surrounding organs. Total splenectomy is the treatment of choice for giant splenic cysts. The infrequency with which splenic hydatid cyst is encountered makes it a formidable early diagnostic challenge, especially in the non-endemic areas. The endemic areas of hydatid cyst include the Mediterranean region, and the complete aggressive resection is the gold standard treatment of patients with hydatid cysts of liver and spleen, and we aim to remove all the cysts to prevent complications and to prevent recurrence. So, I conclude that hydatid cysts should be considered in the differential diagnosis of all cystic masses in the spleen, especially in the geographical regions where the disease is endemic, and should be managed accordingly to prevent life-threatening complications, which could include anaphylaxis. Thank you.